Switching to health news, El Paso is leading the country in a form of therapy for patients suffering from bladder incontinence. KTSM 9 News reporter Paulina Spencer, she spoke with a professional at the Providence Medical Partners who explains what this implant does.
Bladder incontinence, or an overactive bladder, is a bladder control problem that leads to the sudden urge to urinate, and it affects 1 in 11 women in the U.S. But thanks to a procedure, many patients can get some relief. Patients struggling with an overactive bladder often receive signals to the brain to empty the bladder even if the bladder is not filled. Neuromodulation therapy works like a pacemaker, but instead of regulating the heartbeat, it regulates the bladder. The device is implanted in the patient's lower back, and it helps send the correct signals to the brain. And unlike other medications, the treatments can be done once and last up to 10 years.
We have a way of kind of biohacking this nerve conduction pathway between the bladder, spinal cord, and brain, where your bladder wants to tell your spinal cord, hey, I'm full, but you're not really full. And this signal that leaves the bladder, we have the ability to kind of intercept that signal, turn it down or turn it off.
Dr. Farnham adds that it's important to understand that this procedure is not neurosurgery. They don't operate on your spinal cord. All it does is adjust the peripheral nerve, and it only takes about 15 minutes to be implanted. Now, this procedure has been done for more than 15 years, but new technology has allowed the device to go from a 5-year battery to a 10-year battery life, making it a more convenient treatment for patients. Reporting in the studio, I'm Paulina Spencer, KTSM 9 News.